and I have two guests with me today who's going to really share some of their insights with us. So would you mind introducing yourselves?
Certainly. I'm Dr. Erin Spicer. Erin, please. We're from London Health Sciences. So London is about 2 hours west of Toronto in central Canada.
Thank you. And you?
I'm Mark Goldszmidt, and together with Erin, I also am a clinician and a researcher, and we together run a quality improvement hub where we work with folks to improve the quality in our center.
Amazing. I had the privilege of being in your session, and I was just wondering if you could kind of share some of the highlights from that.
Sure. So, the session itself was actually really fun, not only because Erin and I had our work to present, but also there were 3 other presenters who were sharing some of their work. In terms of the overarching purpose of that session, it was really thinking more about how we create quality publications that meaningfully contribute to the literature. For my part, Erin and I have been working on a scoping review with a team of colleagues where we were trying to understand a little bit better how are people writing up their quality improvement reports, ways that we could enhance that, and also things that we could learn as we support our learners and mentor them and other colleagues in their first forays into quality improvement. For me, I think the fundamental takeaway was really related to how we're actually conceptualizing what is the genre of writing up a quality improvement report. Too many people, unfortunately, are forcing themselves to fit into a mold that doesn't match with the QI report, this idea of writing a background, methods, results, discussion section, which doesn't really lend itself well to the QI report. And so thoughtfully, coming up with the most effective way of conveying the type of work that we're doing in ways that contributes to the scholarly conversation in the world, to me, that's the most important piece.
Thank you. And I remember from your session, there are some key things that people are not doing so well when they're thinking about reporting in quality improvement. And I was just wondering if you could share with us what some of those common, not necessarily errors, but sort of the common challenges that you noticed through your review.
So in our scoping review, we've referred to them as the pitfalls in writing up quality improvement projects. And there's a variety, everything from the quality of the aim statement, which really sets the tone for the subsequent paper, right down to the methodology, the measures being used. And so there's common pitfalls that we see across publications in our scoping review that, if addressed, and usually the solutions are fairly simple, add to the rigor of not only the publication itself, but if actually done well, adds to the rigor of the quality in addition. And the reason that that's very important to us is, as Mark mentioned, one of our key loves of our job is to be able to mentor and coach others in learning how to do quality improvement. And oftentimes our mentees look to the literature for examples of how to write those aim statements, which measures to pick, how to do authentic PDSA cycles. And when we can strengthen those results in the literature, then the people that are doing the QI work have really strong, rigorous examples to follow, and then we have this kind of flow or ripple effect where better quality improvement work is being done because better quality write-ups are happening.
Thank you. And I can certainly relate to when you're trying to write a paper, you're looking at what has been written before, and then things just don't quite fit, but there is almost that expectation that you then have to follow what has been done before. And so it's how do you break that mold? And I was just wondering if you had any sort of tips or key things that we could take away when we're thinking about what we could be doing differently.
So I'm less certain it's about breaking the mold, because at least from the quality improvement report, I think we're still early on in our kind of maturation as a field to what it actually is supposed to look like. So what we'd say is, don't try and write it like a randomized controlled trial or some other clinical work. Write it like it's a quality improvement report. We did find for sure tons of examples we'd say, hey, don't do that. But we also found some excellent examples out there where people have really kind of nailed it. They kind of have the right way of expressing, first of all, how they're contributing to the conversations that are existing in the literature around quality problems. And I would say look to those. Don't always assume that one paper is going to have it all right, but look to multiple examples. Find ones where they just wrote a brilliant section on the root cause analysis and say, hey, I want to make mine look like that. And then look to great examples of a discussion from another paper.
I think that some of those great examples that Mark is mentioning, we didn't have time to go into in our presentation today, but the work is being written up for publication and we hope to have it submitted in the summertime. And in that publication, we name the pitfalls, but we also give the really exceptional examples of how people have communicated what they've done really, really well. And so excellent examples for our mentees to use for their quality improvement design going forward.